body is a machine designed to heal itself. You know, sometimes our bodies, though, need a little help. But what if you could harness the power of your own body and speed up the healing process? I spoke with one doctor working with orthobiologics to find out more about how patients are using it to recover faster.
You guys have DBM in here, right?
Yes, sir.
Okay.
It happens in surgery centers across the Gulf Coast every day. Surgery teams preparing patients for routine and non-routine surgeries. On this day, Naples Dr. Edison Valle and his team are repairing a vertebrae in the lower spine, a herniated disc, bone on bone. More than a year of excruciating pain finally relieved. But this is why we're here. Before surgery begins, nurses take a blood sample and drop it in this machine and pull out liquid gold.
All right, everybody ready? All right, please.
It's called orthobiologics. Think of it as hacking our own bodies to speed up recovery.
Go leave there.
For years, Arthrex, which is headquartered in Naples, has been making strides in the
Yeah,
field.
so orthobiologics is really being able to leverage the patient's own biology to help aid in healing.
It can be used in a variety of ways.
So that can be coming in the forms of different blood products, adipose tissue, bone grafting, soft tissue, and even cartilage products as well.
This has changed my practice in many, many ways.
Dr. Valle is one of the leading surgeons in the country who uses orthobiologics.
Recovery is faster. The pain after surgery is very minimal. Some of my patients are just going into Tylenol. I mean, this looks great.
Am I cleared to fly on a plane next week?
Yeah.
That's me on that operating table. Basically, a construction zone.
X-ray.
The entire procedure took about an
X-ray.
hour and a half. In order to reduce the compression of my spine, Dr. Valle inserted support.
X-ray. What we had to do was to reconstitute the curvature or the correct plane of your spine. So in order to do that, I had to insert a wedge that will basically level that abnormal disc to height.
He also applied that liquid gold, platelet-rich plasma, or PRP, and he applied it right to the wedge and around the incision itself.
And what will happen is we do a spin that's able to separate out the blood by plasma, a buffy coat, and a red blood cell layer. And when this occurs, what we're doing is pushing the platelets down into this white layer. And then in our ACP syringe, we'll go ahead and pull the platelets in the buffy coat and red blood cell layer into the ACP syringe. And we'll spin that a second time to resuspend the platelets back into this plasma suspension. And then we'll actually be able to grab that PRP into this inner syringe to have your final PRP output.
We have the concentrated platelets, and then we inject those platelets in the area where we want you to heal. In your case, we concentrate those platelets into the bone that we put in there for you to heal faster, and we put them also in the soft tissue that I have gone through. So you have less pain and it heals faster.
Years ago, before Dr. Valle began using PRP, his patients were out for months.
The minimum that everybody was off was 6 weeks. Usually, I'll assign papers for 3 months.
But I was back on the anchor desk 6 days after going under the knife, back in an exercise routine in 2 weeks. And Dr. Valle credits the quick recovery to the power of my own body.
Orthobiologics can be used by surgeons, also pain management specialists. You just have to consult your physician to find the right treatment plan for you.